Well, good morning and welcome once again to another business community support discussion here on Facebook. We've been doing this for a number of weeks now, months really, as we've been discussing how COVID-19 has affected our lives, both in business and more recently as parents and everything else that we're having to deal with. So we invite you to join us here on Facebook and add your comments, add your questions, and we're going to get to those. And each week we sort of have a different topic that we've been discussing as we go along. And this week we're going to be updating specifically on COVID-19 and exactly, how that's playing into Webster County. We have some great guests who are going to be joining us in just a moment to share their take on it and their expertise. But for the moment, we want to get to our regular contributors and say good morning to them. Of course, we have Cheryl O'Hearn from Spin Market Plus Digital. Good morning, Cheryl.
Good morning. Welcome. Happy August.
That's right. We also have Chris Patrick with Main Street Fort Dodge joining us today. Good morning, Chris.
Good morning. Thanks for having me.
What's that?
I said, thanks for having me back.
You're part of this show. You can't get away from it, Chris.
Oh, okay.
And we usually have with us Kimberly Tiefenthaler with the SBDC, and she's got some prior engagements, isn't going to be able to make it on first thing this morning. But, we do have some information from her that we'll be able to share as well as we get further on into the program. And Cheryl, today it sounds like we're going to be talking mainly about COVID-19 and what the latest updates are with that.
Yes, COVID-19 is going to be our subject. Yeah, we're going to be talking with Carrie Prescott with the Webster County Public Health, Carrie Williams with Community Family Resources, and Regina with the Community Health Center, all talking about what's going on in our community and just the update of where we're at and some really important details that everybody needs to know about. So we encourage you to also hop in, and if you have a question, to put that in the comment section.
Yeah, and that's one of the great things about doing it on this platform is that when you do post any comments or questions on Facebook, we can see those immediately and respond to them. And so, even if you're not seeing it live, feel free to make those comments, and we'll try to get back to those as soon as we can. But we love it when we get the real-time live comments to go over as well. So let's get right to it today. There's a lot to get to. So we're going to bring Carrie Prescott on, and Carrie is the Webster County Public Health Director. And so we want to say good morning, Carrie.
Good morning. Good morning. And thank you for having us on. Oh, I need to shut this off. Hang on. Okay. Yes, thank you for having us on. Thank you.
Well, we're always glad to have you on. You always share a ton of great information with us. And we know that you've got other commitments that you have to get to this morning. So we're going to dive right in. You guys have been doing your best. And I think the questions keep coming like, okay, what data is being collected for Webster County Public Health? And how do we get that information? So let's talk a little bit about the data that you guys are currently collecting there at Webster County Public Health.
Okay, thank you. So we continue to do contact tracing, which is a vital piece in our community to understand where the linkages are of any of our positive cases. As our Facebook page is going to be or will be or has been updated regularly with accurate counts from the county. The process is when we get a positive case, we make sure that it's in Webster County. Sometimes they get transferred to another county or they don't live here. So we want to make sure that we provide accurate information, especially for to hopefully reduce some of the anxiety in our community. And then more importantly, to give accurate information to all the decision makers in the county. So as of Monday, we had 750 positive cases, and that's an accumulative number. So that started way back in March. And as you know, we have a prison system here within our community. And so we like to do a deep dive in our community's numbers so that we have an accurate snapshot of really what's going on. So we have 750 on Monday. We had 14 more positives came through the prison. And when I say comes through the prison, we are on site doing the testing at the prison. We have our eyes and ears and work very closely with our prison system to understand what's going on out there. And they're doing a downward trend, which we are very happy. We work very closely with the correctional facility staff and Iowa Department of Public Health in doing appropriate testing and monitoring with our inmates. So as far as an outbreak, I think we had a best case scenario with, I mean, nobody wants an outbreak, but it's been very well organized with all stakeholders. So a shout out to the correctional facility staff. They've been amazing to work with. So from Monday, 14 additional came from the prison, and then 28 additional is based in our community. So that brings our total up to 792 cases. So if we take the 792 and we subtract 355, which are from the prison, that leaves 437 out in the community. So that gives us an accumulative number. So then what our staff does is we actually go down and dig down deeper on who did we release from isolation, and we kind of focus on what's actually active isolation cases in our community. And so we will post all of this information as often as we validate it. Hopefully every other day. We will try to do it every day if we can. So as of this morning, we had 437 in our community. We have released 338 from isolation. So that means we have 99 open cases in our community that we are monitoring signs and symptoms. And then with the prison, we had 355. They released 323. So they have 32 that they're monitoring on our behalf in the prison system. And so that gives us a little bit more real data of what we're experiencing in our community. I think
those active cases are an important touch, and it's not a number that we've actually been seeing on a lot of national scale as far as the current picture. And I think that active number is a really important number as far as where we are in our community.
Yeah, and it's exactly right, Jed. So as we work with our school system, we work with our skilled nursing facilities because they have phases that they're trying to, open their long-term care facilities to out to the community. As we work with Iowa Central Community College, there's another population that we have to be considerate of. We really want to look at this percent of positivity and get an accurate number. And then we want to see this downward trend. Now, we expect positives to come from all three of those. And in our community, we expect numbers to most likely increase or hopefully decrease in our prison population. But if we can get a sense of, it was a cluster. So this particular event or this particular business or this particular situation, we can kind of isolate or we can kind of cluster where our positives are coming in. And that's all from the contact tracing. So I want to talk a little bit about what does it mean to be released from isolation. When I know that we have a lot of people that go on the state dashboard, and I continue to encourage you to go to the Iowa Department of Public Health. They have data that is pertinent. If you want local perspective, though, I encourage people to go to our local Facebook page. The release from isolation, our department follows the 10 guideline. So if a positive person, we are doing isolation, we will release them from our numbers on day 10 as long as they're not symptomatic and they are not showing any type of symptoms. The state database will not release that person until day 28. And so our numbers are never going to balance with the Iowa Department of Public Health dashboard. And I think that's a valid point to talk about, because as our decision makers are looking at that dashboard, it's skewed. So it's not a real reflective, it's not real accurate information of what's going on in our community.
Why do you think the difference, Carrie? Why did you decide to use the 10-day model, and why do you think the state's using the longer model?
Yeah, I think the state, and I just as just a hypothetical thought of Carrie Prescott, I think that day 28 just gives like a solid date that by day 28 the signs and symptoms should be relinquished from the people that are positive. I think there was some discrepancy on when a local public health may or may not have released somebody from isolation. We have a lot of people, the state has hired people to do isolation and quarantine, contact tracing. It takes us, you can't just walk off the street and do isolation and quarantine work. I mean, it takes a little bit of a know-how to operate the system, know how to ask some of the questions. And so I think there's a broad basis of people entering that. And so there was some discrepancies between the system. And so I think the state just moved to 28 days. We're going to release them. Whereas
I think it would make sense where the state, they don't necessarily have the ability to check for symptoms. Whereas on the local level, you guys are able to check for symptoms. And after 10 days, if they're symptom free, you can, be a little bit more hands-on, where the state may be taking just a hands-off approach and just saying, we're going to use the 28 days and we don't have to monitor symptoms. Is that kind of what you're saying?
That might be one of the factors. Yep. It's hard for me to say what goes on in their mindset, but from a local perspective, it's vital that we know what's going on in our community to be able to give that information. And so we were very diligent to stay with the 10-day isolation and call everybody to make sure that we're doing appropriate monitoring.
Can you share with us what exactly isolation means? If Carrie comes to me and says, Jed, you have to isolate, what does that mean for that individual? And are you getting, a good level of participation? Because I'm guessing you don't shackle them to their bed.
No. So that's a great question. So when we call and I say, Jed, you have been, has your provider called you to let you know you're positive? And usually yes. And then we just walk in or we don't walk in, we say, you need to be isolated. If you live in a home with loved ones, we ask that you maybe move to a different area. If you can go to a basement and really focus on not being closer than 6 feet around your loved ones. We are seeing that the transmission is primarily with that close contact for more than 15 minutes. And so a lot of the contact tracing is identifying, yes, I sat next to my husband for dinner, and now the husband is positive. So we really stress that you as a positive person, do not go to work, do not go out in the community, stay confined to your house or wherever you are currently living, and do not go out in public. And then if you have, let's say you're a single person and don't have capabilities of getting out or utilizing home delivery, we will also offer staff to get you groceries or bring you your medicines or whatever you need to do, because we do take that very seriously, that we do need people to isolate. Usually we will call everybody about every other day just to check on them. We want to make sure that they're not assuming that their difficulty breathing is just part of the process. We are seeing that a lot of times when we have a positive case, about day 6 or 7 is kind of that turning point. They're either going to get really, really sick at that time, or they're going to bounce back up. And, a lot of people are reporting, I just had a sniffle, or I had a terrible headache, or a lot of mild symptoms, but we want to monitor and make sure that we connect with people that might be having a little bit more severe symptoms. And especially those that have any kind of co-medical conditions. So we really monitor them closely. And we call. We've had situations where we've had people that were a little bit more challenging. And so if we have to, we do have the authority to initiate or implement orders where they're signed, and it includes law enforcement and things like that. I've not had to do any of that. Usually once we talk to people and explain the importance of it, we have a lot of people usually comply. So,
yeah, that's good. Okay, so one of the topics I really want to discuss, because I think it's forefront on just about every parent's mind, is as we head back to school. There's just a ton of concern from parents about, is my kid safe? Are there precautions being taken? And I know, the superintendent's been in close contact with Webster County Public Health. So can you talk about some of those conversations and, what public health's stance is on returning to school?
Right. And, we need to go into the opening of the school that is very, very charged. It's, a lot of people it's emotionally charged. It's, politically charged. I mean, there's a lot of stuff going on around opening school. And so what we want to do is just make sure we provide the best guidance, for the decision makers, as possible. And so, we have been meeting. My counterpart here is actually at a school-based meeting right now, talking about other opportunities to provide face shields and PPE for the school system, and then talking about how do we perhaps cohort children. I mean, just lots of different brainstorming ideas on what is the best by school room, by school system. And so they've been very wonderful to work with. A lot of brainstorming activities are happening. The big piece that we as a health department need to provide to the school is this percent of positivity, because that is a dashboard, that is a metrics. And so I've got some feelers up to the state to make sure that I can independently provide a document that is a real snapshot of what's going on in our community. And so there's a lot of confusion about the state made this dashboard of positivity for the schools to be able to click and check the rate. One of my counterparts texted me last night and said we're number one. So when I kind of looked at the data, it's skewed. It's skewed because of the prison numbers. And so any person that's would not maybe be prevalent of knowing what's really going on in Webster County might just look at that number and say, oh my gosh, we're at a 50% positivity rate or whatever the rate was. And it's really not.
It was 46 the other day I looked at it.
What'd you say?
I think it was 46 the other day when I looked at it.
Yeah. And that's just, it's not an accurate number. And so I need to figure out a way that educate our decision makers, get a stamp of approval that my department can provide some accurate data. And so that's my challenge, to try to help the school systems, Iowa Central, the skilled nursing facilities, that we have one document that you can reference. And then hopefully our parents can also have it. The more transparent we are with our community, the more that hopefully we can get back to some type of norm. We need to figure out how to live with this virus in our community in a safe manner. And so that's our goal. And however we need to do that to get the right data out in the community, we absolutely want to be that leader. So
a couple questions on that, Carrie, because we keep coming back to this percent of positivity. How important is this metric? Because it does seem that it can, I guess, adjust wildly based on how many tests are performed.
Right. Well, and is that, so there's some discussion. Do we look at how many tests are performed? Do we really take our positive numbers and then our open cases? Is that more an accurate reflection of what really is positive in our community? So there's a lot of discussion and of course, a lot of opinions around what numbers we absolutely need to use. My hope is that our Board of Health will approve it, the school board. Once we get this document, we will share it with the people that absolutely need to utilize this, explain it, how we get the numbers, have a timeline of when we're going to report the numbers, and then hopefully we can all land on, yes, this is an appropriate document that we can all agree upon.
Do you think you'll be including prison numbers in those cases, or do you think you'll be able to exclude those?
My hope is that we can, just for the mere fact that our prison population are not out in our community. Now, any staff that work at the prison that are in our community would absolutely need to be counted in our community numbers. But my hope is once we move forward, we include them in our overall numbers for Webster County because they are residing here. However, then funnel it down to here's what we have going on really in our community. Skilled nursing residents that are confined to a skilled nursing facility are kind of in that same boat. They're not out in our community. And so we're talking about, do we really dissect all of the data? So we've got X number of inmates, we have X number in the residential facilities, and this really is our community. So there's a lot of discussion that we need to have pretty quickly on landing on what this data will look like, and it'll evolve. So we're willing to produce the data that is absolutely necessary for the people, and they need to have a comfort level with how we're reporting.
Great. Carrie, I know you've got a meeting you've got to get to, so I don't want to keep you, but is there anything else that we need the public to know right now regarding COVID-19?
Yeah, so in our contact tracing, it's very eye-opening to me that people are assuming their sniffle or their headache as just allergies. And so the big thing I would be want to get out into our public is, if you are sick, do not go to work. Do not assume that it's an allergy, that it's a sniffle. Call your supervisor, let them know that you are feeling sick, and work with them on your time frame. If you've been exposed or think you've been exposed, absolutely go get tested. But that's what we're seeing is we're seeing a little bit of these clusters because, I didn't think I was that sick. I had a headache or I had sinus, and then it ended up being a little bit bigger than that. So please stay home if you're sick. If you're out in public and you can't social distance, again, like I stated earlier, that social distance, that close contact is what we're seeing for positivity rate or positivity exchanges. So social distance is a huge piece. Mask if you can't social distance, or mask out in the community. And then definitely mask if you are going to be in close proximity of anybody that you do not know where they have been or what their exposure history is. So.
Great. All right. Well, Carrie, I know you've got a meeting to get to, so we'll let you off the hook here, but thanks for joining us and sharing all this great information.
Yeah. And our office is open. We have the COVID hotline, so please give us a call. We want to be the resource out in the community. So thank you.
All right.
You bet. The information that you provided on breaking down the stats, that's huge, because the numbers say one thing, but you really need to go in and do a deep dive to really
Absolutely.
understand how it all
Thanks for
works.
having
So
me.
thank you very
All
much.
right. Bye, Carrie.
Bye.
We have just such an action-packed show today with tons of updates on COVID-19. So I want to keep going along. I'm going to bring on with us Carrie Williams, the Mental Health and Clinical Director from Community and Family Resources. Carrie, good morning.
Good morning.
So
Good morning,
I'm just so glad that you're joining us, because mental health right now seems to be one of those topics that is maybe something that a lot of folks don't want to talk about, but I think it's something that right now, as people are staying at home more, they're not hugging people like we talked about earlier. It's definitely making an impact on people's mental health, wouldn't you say?
It's a huge impact on anxiety, depression, you name it. The mental health, just the feeling of isolation and the feeling of anxiety around COVID and around loved ones and family and work, and am I going to get it? Am I not going to get it? Has made a huge impact on a lot of people. Absolutely.
Yeah. So are there statistics, are there numbers that, you're able to share? What sorts of things are you seeing? Or is it just, there's been an obvious increase in these cases. What are you able to report when it comes to that?
I don't have any statistics right now specifically to Webster County. I know that we've been working with the state on several different initiatives just to try to figure out, and even state data is lagged in terms of being able to report whether there's an increase or not an increase. So I don't have specific stats that I can give you around mental health or even substance abuse at this point. We do know that there appears to be an increase. Whether that's borne out statistically, I don't know. And I can't share that information. We have seen a lot of people, in terms of reported higher anxiety, reported higher depression, potentially even having to grieve over maybe a loved one who's committed suicide or has overdosed. And so just a lot of those kinds of issues are kind of coming up right now. that we're working with those folks on. And we really encourage people to stay in contact with family, whether that's through social media, yes, but we tend to be careful about that because too much media also brings on that anxiety. Too much obsessing about COVID or the data or whatever can also bring on that anxiety for a lot of people. Um, a lot of people are staying in contact with family members through, say, even Zoom, or some form of, live chat. But staying in contact and not just isolating, because we are social creatures. And when we isolate and that socialness goes away, just even the data around a hug or being able to talk or being able to see, is very important to people who are very social creatures. And so this tendency to, or the mandate to isolate if we do have a case of COVID, tends to then bring on more depression and anxiety and potentially more alcohol and drug use.
So one of the places that I think is very difficult would be for many of our senior citizens. Not only are they the most at risk, but they're probably also getting less face-to-face contact than ever before. So for those of us who do have, loved ones, parents, grandparents, what do you suggest? How do we help take care of those social and mental needs in a time when, our physical presence may be dangerous?
I think we have to become creative in terms of calling, and you see posts about people that have gone up to windows to say hi, and just to be creative in some fashion. The senior citizens that get to wave hi to a long line of people that are driving by and saying hi, yelling out the window. You see this creativity that has actually been a positive that has come out. And I think we just have to continue to be creative in terms of letting them know that we love them and that we're thinking about them, even if we can't be right there next to them and give them that hug. Or to be able to sit down and just have a chat with them face to face. So I would just encourage that continued creativity in terms of um, finding a way to stay in contact with each other, with our loved ones, with our elderly parents, even with our kids, and they're wanting to play with playmates. And I mean, it's the whole entire gamut. It's the whole population. Um, that we have to just be more creative around.
Yeah, and it does seem that there is, maybe some self-medication when it comes to depression and things like that. People turning to drugs and alcohol as a hopeful solution. When we look at alcohol sales since March, they've been up significantly, and I don't know that maybe you can or maybe you can't directly tie that to domestic violence issues and things that go along with it. But it seems to be that people are turning more to drugs and alcohol in this time.
There does appear to be that. I think early on I had identified that there was a lot more prevalence, even if you just walked into a general store, with drug and alcohol being right there where it didn't used to be. It used to be chips and candy bar, and then it became alcohol. And so I think that didn't help. But also the isolation, the anxiety, people want to numb that out and not feel when we need to be able to feel and address rather than numb out. And so, yeah, we've seen a lot of an increase in drug and alcohol use. It does tend to increase domestic violence as well as child abuse. A lot more scenarios around a lot of those. And again, if you're in an isolation event and you've been in an isolation event for a while, you tend to be more angry, impatient. Again, it's that I need contact, I need social. Again, we're social creatures. And so, people tend to want a quick fix, and quick fixes don't necessarily work.
So if a person has a friend or family member or child or whatever it happens to be, maybe even a coworker, and they suspect that maybe there is a problem here with drugs, alcohol, depression, what does that person do? Because that can be a touchy subject. It can be uncomfortable, difficult to deal with. How do you suggest folks handle that?
I think we just have to be able to have that honest conversation, to be able to say, this is what I'm noticing. There's a difference between here's what I'm noticing and you are. And so, I think we have to be able to have that open and honest conversation, but not necessarily in a pushy kind of a way, to say, here's what I'm noticing. And, I think we need to get some help. We, as in, even increase in drug and alcohol use is a family event, even if it's just one person. It is tied to the entire family, and it impacts the entire family. So it might be a conversation of we need to get help. And just to be able to encourage that person to make that phone call, or to walk in, or to contact an agency via their website and say, I need to get in for an evaluation, or I'd like to talk to somebody. We've had people send letters to us where then we can turn around and make that contact. And so, there isn't a wrong answer to how do you contact an agency to get help. And, Community and Family Resources, we have the website, we have telephone. Again, you can contact us by letter. You can walk in and talk to us. We will ask you to wear a face shield or a face mask. We'll ask you to put those precautions on, as we are also putting those precautions on. But, from any of those types of contacts, we're going to try to figure out what is going to be the best to help you out as a person. Is that inpatient, substance, residential? Is that detox? Is that outpatient? Is that mental health? What does that look like? And sit down and try to work through that.
Just because this tends to be something that we think of as an adult problem, it certainly doesn't mean that our kids aren't dealing with stress and anxiety surrounding COVID as well.
I sometimes wonder if our kids are not dealing with it more in some ways, just because, again, if you're attuned to another person, you're going to feel what they're feeling. You're going to know and understand what they're feeling. So if we have anxious parents, that is going to have an impact on anxious children. How many of our kids choose to just stay home and not play? Like, they are, again, very social from a very young age. They want to have playmates. They want to go play. Swimming pools, 4th of July celebrations, like, everything is just different. We haven't been able to have the old norm at all. And so, even being able to go to a park, or being able to go to a friend's house, all of that has an impact on children. And spending too much time on video games and video consoles also has that impact on children, and it increases irritability, it decreases the ability to pay attention. All of that just has a huge impact. And so, yes, we have seen an impact on kids being extremely anxious, being extremely fearful. They feed off of adults and parents in their lives. And so if you have an adult or a parent that's extremely fearful or anxious, that is going to impact that child.
So we want to make sure that people have those resources to get a hold of you. It sounds like just about any way is possible to get a hold of Community and Family Resources, but phone calls, even letters, or just drop by. It's okay to do it all.
Absolutely. And we would love to just sit down and have a chat with you and say, what is it that you need? And try to figure that out, go from there. No judgment. Make that phone call. If you need to talk about your feelings, if you need to talk about what's going on in your lives, drugs and alcohol, suicidal ideation, depression, anxiety, even if it's paranoia, and wondering about whether that is reality-based versus kind of the functionality of what's been going on in the media. Come on in, and we'd be glad to sit down and either come up with an appointment or sit down and talk to you, try to figure it out and work within whether or not you need to do it via telehealth, or whether you need to do it in person. We would gladly welcome you in.
Well, great. Carrie, thanks so much for coming on and sharing all this great information. And, hopefully people take advantage of those resources as they're available.
Thank you.
All right. Wow. Once again, just such good information that we have to share. We have another guest that we want to bring on, Regina Subir with the Community Health Center here in Fort Dodge. And obviously I recognize you guys have other facilities as well, Regina. It's not just here in Fort Dodge. So busy you guys are.
Yes, we certainly are. And we appreciate being invited to the conversation today. I am the outreach coordinator for the Community Health Center. So while you've had some great folks that can really talk about the medical aspects of what's going on, that's not my expertise, but I'd love to give you some information about what's going on at the health center and about our National Health Center Week next week and some of that.
Well, I know that, as you know, our radio station where I sit currently is sort of right across the parking lot from you guys. And so each day as I come in, I see the folks there at the center setting up and doing testing right outside the building.
That's correct. We are providing testing. We have a setup out back. We are open 6 days a week right now for COVID testing. The most important thing for you to know is that an appointment is required. So we do need you to call and make an appointment, but we do have testing available. If you've been exposed, if, the folks from Carrie's office have called and said that you were in contact with someone, if you are experiencing symptoms, we encourage you to call and make an appointment for COVID testing.
And you don't even have to get out of your vehicle to make that happen, it looks like. It seems that people are getting that done from right inside their vehicle.
No, it's very organized. There's numbered parking spaces. Someone will come to your vehicle with your registration information. Then someone will come back and administer the test for you.
So the testing is obviously one piece of it, but you guys have a lot of different services that you offer aside from just, regular testing. And it seems like there's obviously other opportunities for Community Health Center when it comes to COVID-19 other than just the simple testing.
There are. And, this all ties in really well together. With National Health Center Week being next week, the theme that the National Association of Community Health Centers, they were on a different path for theme, and then they switched up and they changed the theme to Community Health Centers, lighting the way for healthier communities today and in the future. And they gave a little explanation about why they did that. And part of it is to honor the frontline providers during the pandemic, as well as beloved patients who have lost their lives during this ongoing COVID-19. So, it really ties in well with our Health Center Week and your COVID conversation today. But as part of Health Center Week, normally we have a block party, and that's not happening. But those services that we provide for kids for back to school, healthcare needs that every kid needs and is required to have, from well child checks to immunizations to dental screenings. We are unique that we have medical, dental, and behavioral health all under one roof at our building. So that's a really nice thing for parents and families, a time saver to be able to come and take care of everything at one place. Typically, we offer those services free to kids during our block party. Since we are not having the block party, we are just celebrating all week long next week. So if a child is in need of those things for back to school, they can call, make an appointment, and come in. If they do have insurance, we do bill their insurance. But if they do not have insurance, they are still able to receive those needed services.
Yeah, each year when you guys do this, and I had the pleasure of being there last year, there were a lot of people taking advantage of, free sports physicals, those sorts of things.
Yeah, absolutely. And that is the fourth piece that I didn't mention, was that we do offer those sports physicals for school too. So any of that, any child, any age, depending on what grade they're going into, really depends on which things they are required to have for back to school. And so we want to make sure that, every child, every child in our community gets those needed back to school services. And then for fun, because it's National Health Center Week and we like to have fun during the block party, we've got a coloring contest going on for the kiddos. So when they come to the health center, they can pick up a coloring page and a box of crayons at their appointment. If they don't have an appointment, they can print a page off of our Facebook. And then we've got a drop-off box outside our building so that they don't have to come in to drop off their coloring page. They can just pull up to the curb, run out, put it in the box, and that they can be entered in our contest.
Yeah, it's great. I mean, you guys do such a great job during your block party and all year long, doing great things for the kiddos. And so it's just a neat thing to have you guys be a part of it. Can we talk for a moment? And obviously you guys are bound by all sorts of HIPAA regulations and all sorts of things like that. But as we do go back to school, a lot of these kids have been isolated for many months now. There at your health centers, are you seeing more issues with kids coming in and, dealing with anxiety and dealing with those sorts of issues?
That's not information that I'm privy to, so I can't share that with you.
Yeah, fair enough. So you guys have a lot going on with your block party, but it sounds like people can definitely still get a hold of you and schedule those appointments that they maybe taken advantage of in the past. How do they do that, Regina?
So they just give us a call. Our phone number at our Fort Dodge office is 515-576-6500. So for the back to school services, they can call that number. They will be connected to one of our care coordinators who will help set up those appointments. And the same goes for that COVID testing, Jed, that you see going on out back. That same phone number, 515-576-6500. Get you a hold of someone in our medical department to be able to make that appointment for COVID testing as well. And then, some folks don't know where we're at. You do, because we're right next door to you. And that's a landmark we often use, but we're located in downtown Fort Dodge. We are very near the radio station. We are also near the very large Methodist church, which is on First Avenue North, but we are 126 North 10th Street. So we're very conveniently located downtown in Fort Dodge, and encourage you, if you know someone whose children need those services, if your child needs those services, back to school is coming. We don't know how that looks for each family, but either way, those medical healthcare routine appointments are very important.
Well, the only thing I'm going to miss out then on your block party is the delicious food that I normally get, but I'll look forward to it next year.
That is very true. We usually have pork producers come and serve a meal. We did switch gears. Fairway has been generous in donating buns and condiments to us, and they are changing and donating cookies. And we are going to individually wrap those cookies, and patients that come in during Health Center Week as part of the patient appreciation portion, they'll get a cookie after their appointment. So that's kind of just a fun thing for any patient who's coming in and acknowledging National Health Center Week.
Well, great. Well, thank you, Regina, for all you guys are doing for our community, not just in Fort Dodge, but all your other locations as well. Thanks so much.
Thank you.
All right. Thanks, Regina. Bye-bye. Cheryl, Chris, it's been a busy show, but tons of great information today regarding, what the latest is with COVID-19. And the thing I love about it is it's local information. We can look at that state website all we want, but it really doesn't give the picture about what's happening in Webster County.
Yeah, and all three of our speakers were able to really give some great information, as well as making sure that everybody knows that those resources are local, that they're right here and they can find them. All of them are digitally set up with their websites and communication with email or whatever it may be. So along with, of course, phone calls and actually just walking in the door.
Right, and it's also accurate information. I mean, it's right from that source, so we know that that information they shared is to date and it is accurate. I think that's really important for parents.
Very much.
Yeah. For sure. So let's keep this moving because we are a little bit short on time. We have the Shop Iowa program that's going on, and so let's talk a little bit about kind of the latest with that and what that is.
Sure. So I know on this platform, we've been talking about this for, gosh, 2 or 3 weeks. But if you haven't heard, Iowa Economic Development Authority started this initiative for our brick and mortar retail stores and called Shop Iowa. They're working with Iowa-based company called Member Market, offering this marketplace to Iowa small businesses. And they have to be under 25 employees with a gross income less than $4 million. And it's free for 1 year. That's until June of 2021. So this is really an awesome opportunity for our businesses to get their products online with a statewide, well-promoted platform. And I think that's really the key to this, that the state of Iowa is also promoting this. So the reach for that digital footprint is going to be larger than if they're just using Facebook. So you do need to be a brick and mortar retail store. And we've been working with business here in the Main Street district, and so they can contact our office if they have any more information or any questions. But if you are not a Main Street business, you can contact Kimberly Tiefenthaler at the Small Business Development Center, and she can get you connected with that program. But as a customer, customers are able to go on to the shopiowa.com site, and they can shop by category, so they can figure out what product that they're going to be wanting. They can choose a local pickup from any nearby business or have items shipped directly to their doorstep. And maybe it's a business they've never visited before, so they have a great opportunity to be trying out some new local, independently owned businesses here in Fort Dodge to really see what our community has to offer. I think that's probably the highest point, the main point of this whole program is to really be supporting all of our local businesses. And I think there's the other side of why they should be selling on Shop Iowa. And like I said, it is free. We do hope that they continue to do their own digital footprint and making sure that they have a Square or something else set up so they can do online sales from their own website or Facebook page. So I think that's pretty important. And they can, again, get this information at shopiowa.com. They can go to info@shopiowa.com or reach out to Kimberly Tiefenthaler or myself. And then Cheryl has included a great slide of some of those items that you can get from businesses and how those businesses are taking pictures of each individual item, and then they are doing a price point on those, and then keeping track of that digitally through that platform. So great opportunity for all small and independent businesses throughout the state.
Yeah, and so I thought it was just a neat opportunity to see kind of how that actually looks like as a shopper. You can even see some of those businesses where they're actually located as you shop through there, and it might surprise you to find some of the neat things that businesses right here in Iowa, even some of our smaller communities here in Webster County. Just because you're in Duncombe doesn't mean that you can't participate in the Shop Iowa program, right? So take advantage of it and get exposed to shoppers that you wouldn't otherwise have the opportunity to ever find by going online.
Absolutely. And all they have to do is go to that shopiowa.com site, and you can shop by store if you have a special store you're looking for, or just a category. I think that's the part I like, is you can just hit that category button, kind of like what you did, and see what they've got going. Right now, most of our Main Street stores have not taken that opportunity. We're working with them to get that set up. We did do a quick poll of some of our retailers this last week, and they're back about 50% of in-person sales. So still really down for this year. Looking into that last quarter, we're really needing to, utilize every resource possible to get their sales up. So that's kind of an important piece too. And there's also a new initiative from IEDA, and that is that Iowa Nonprofit Recovery Fund. I don't know if we have time to talk about that or not, but if you are a nonprofit serving, at-risk clients in the community or throughout the state, that's really the top tier of this program, up to $25,000 grant, as long as that nonprofit has a 501c3, a 501c6, or a 501c19 nonprofit. So we can talk about that next week, but I just wanted to give that out there real quick.
Yeah, and I just did a little look on the Shop Iowa. We don't have anybody in the 505 Fort Dodge area at all on there, and that's very disappointing because this is very, if anybody's intimidated by it, you shouldn't be. It's not that difficult. It's a very easy program to get on, and if they have questions, I'll be happy to help them even. But this is a perfect opportunity for them to try something without any cost, and we really need to push our area businesses, our brick and mortar retail, to use it.
Well, and with no cost, there's no reason not to jump into the fray.
Yeah. Very much so.
That's it. They're going to find out they like doing it that way too, just as long as they keep their brick and mortar store. It doesn't take that long to snap those photographs of those products, just making sure you have good lighting so we can see it really well.
Right.
I mean, we all agree on this. It can be intimidating, but once you jump in, it's not nearly as hard as maybe you thought it would be. So one more piece that we wanted to talk about before we say goodbye today, and that's if you see Cheryl or Chris out on the sidewalk and you want to give them a hug, there's a new way to do it.
Yeah, I thought this was really fun. There's more. If you go to the New York Times and pull up how to hug during a pandemic, they've got a whole list and information of the proper way to do a hug, and very appropriate because we heard our speakers talk about hugs today as well.
There you go. Good for everybody to get a little personal contact, and a hug is a great way to make that happen. So
here's my hug to you guys.
I love it.
Thank you.
All right, guys. Well, great show today. Thank you so much for coming on and sharing all the wisdom that you have. Of course, all the folks that you see here is the team that makes this happen. And if you have questions that you didn't want to share during the chat or during the Facebook live stream, you can absolutely get a hold of any one of us, and we're happy to help with anything that you may be dealing with your business, whether that's how to handle and dealing with employee questions, or mental health issues that you may be dealing with employees, or anything like that. If we don't have the answer, we're happy to get you to the right location. And of course, anything from marketing or some of these, scary digital questions that you might have, we're all happy to help get you to the right information. And if not, we're definitely going to make sure that we get you to the person who can help. So thank you so much for joining us today. We'll do this again coming up next Thursday, 9 a.m. for our next business community support discussion. Is there anything else that we need to cover before we go?
I just wanted to do a shout out. If anybody wants to get on and speak, we've got kind of qualified what we're going to do each week, but we would be very happy to have a conversation with you and see when you would be able to fit into our talks in our programs, because we're always looking for different speakers and we want it on a local level.
Well said. And I know that a lot of our viewers have made comments in the past that they love it when local business owners get on and share what's going on behind the scenes and the things that they're dealing with as well. So even if you're running a business, if you could take a few minutes and share with your customers and potential customers what you have going on, there's probably a place for that as well. All right. Well, we'll look forward to seeing you guys next week, same time, 9 a.m. on Thursday, right here on the Main Street Fort Dodge Facebook page. Thanks, guys.
Thank you.
Thanks a lot. Talk to you later. Big hug.
Yeah.